We will now continue with the introduction on your fluid and electrolytes. But before we move on with your IV solutions, I will be discussing to you some basic concepts on F&E, especially on fluid, the body compartments, and your fluid movement, and also your osmosis. So in the handout I gave to you on the whole lecture of your F&E, you have there your fundamental concepts. Your body is composed of two body compartments, specifically your intracellular fluid and your extracellular fluid. 80% or 2/3 of your body water is composed or is found in your intracellular spaces, or it is composed of your intracellular fluid or fluid found inside your cells. Extracellular fluid naman is or only composes 1/3 or 20% of the total body water of the human body. So your extracellular fluid are those that are now found outside of the cells. We have here three types. We have your intravascular. We have here your intravascular, interstitial, and your transcellular. Intravascular would refer to fluid found within the blood vessel. Interstitial naman, those that would now surround the cells. So this is the cell, yung space in here. And then we also have here your transcellular fluid spaces that would now refer to spaces in the body that would also contain fluid aside from those that have been mentioned, such as your digestive secretions, sweat, pleural fluids, intraocular spaces, synovial fluid, pericardial fluid, and cerebrospinal fluid. So normally, in the movement of your intracellular or your ICF and your ECF, ayan, you would normally see them move if or in order to balance or attain equilibrium in the body, nagkakaroon ng movement of fluids from the ICF to your ECF or vice versa, from ECF to your ICF. However, there are some instances na nagkakaroon ng abnormalities when fluid from your intravascular spaces or from your intracellular spaces, they now pull or they now go outside into your interstitial spaces. This type of movement of fluids in the body is not really relevant or very important in the maintenance of equilibrium of fluid and electrolytes. That is why this is actually an abnormality. You call this abnormality your third space fluid shifting. You would note this in some instances, such as in the case of malnourished children. If you noticed, yung mga malnourished na bata, payat yung kamay, payat yung paa, payat lahat except yung tiyan. It's because the fluid from your intracellular and intravascular spaces already moved into your interstitial spaces, such as your peritoneum. Normally, you would not see that much amount of fluid in the peritoneal area because it is not relevant in maintaining homeostasis or equilibrium. So in this case, you call this one your third space fluid shifting. I will be showing you some illustrations on what is your different components or compartments of your body. So we have here your intracellular fluid found inside the cells. And we also have here your ECF, which will now be composed of your intravascular fluid and your interstitial fluid within or surrounding the cells. Intravascular would refer to your plasma or fluid within the blood vessel. And we also have, yung na-mention ko sa inyo, yung transcellular. Usually those found in between the parietal and visceral layers of different hollow organs, such as the heart. We also have the lungs. We also have here your spinal cord. Diba? Meron tayong mga fluid within its layers para they would now act as cushion in order to avoid friction between the layers of some organs. So this would now refer to the different parts or compartments of the body. Okay. Ayan. Now, let's go naman to your movement of fluids. In the movement of fluids, we have here important terms. We have your hydrostatic, osmotic pressure, and your oncotic pressure. Hydrostatic pressure would refer to your pushing pressure, or it is the pressure exerted by fluid. And we also have here osmotic pressure, is also known as your pulling pressure. It is the amount of hydrostatic pressure. It is the amount of hydrostatic pressure that is now needed. That is now needed to stop the flow of water across semi-permeable membrane. It is primarily determined by the concentration of solutes. Your oncotic pressure, on the other hand, is a type of osmotic pressure known as your colloid osmotic pressure that will now refer to the pressure or osmotic pressure exerted by proteins, specifically the albumin, if we're talking about the intravascular space. So in this case, I will show you again an illustration. Ayan. Okay, so in this case, we have here the blood vessel. We have here the particles, solute particles here, and we have here, this is the fluid inside the blood vessel. This would refer to the fluid outside of the blood vessels, or your extravascular or your interstitial space also. And we also have here another cell. We have here your intracellular fluid naman yung nandyan. Okay, so now let's try to determine what is hydrostatic pressure and your osmotic or oncotic pressure. Hydrostatic pressure would now refer to your pushing pressure. This would now refer to the pressure exerted by the fluids within the blood vessel, for example, or within the cell. Your osmotic pressure, on the other hand, would now refer to the pulling pressure, or the pressure that will now prevent fluids from escaping the semi-permeable membrane. So, it is avoiding, or it is now preventing fluid from inside the blood vessels or from inside the cell to go outside into the interstitial spaces. So take note that in your oncotic pressure, it is a specific type of osmotic pressure that is specifically exerted by your proteins or albumin. That is why yung sinabi kong example sa inyo on the child na malnourished, kaya sila nagkakaroon ng edema sa kanilang tiyan during malnutrition, it's because they lack proteins. They lack protein in their diet, kaya hindi nakaka-release ng albumin ang liver. Or, if yung taong yan may liver problem, hindi makakapag-release ng albumin. And we mentioned that albumin is very important because it helps maintain fluid within the intravascular space. So, pag walang albumin dyan, magdi-decrease ang oncotic pressure natin. What will happen? Mawawalan ng pressure dyan, mas madaming fluids ang lalabas from intravascular to interstitial. Kaya, pumupunta sila sa peritoneal space. When they go to your peritoneal space, nagkakaroon ng ascites or edema. So, you'd usually note these types of problems with persons with liver problems or malnutrition or lack of protein in the diet. So, that is the importance of your oncotic pressure. They will prevent fluid from moving from within the intravascular to outside. Yung hydrostatic pressure naman natin, ang problema pag masyadong mataas ang hydrostatic pressure natin, what happens is that a lot of fluid inside your intravascular space can move out. Kaya nagkakaroon ng decreased fluid in the intravascular space or in the intracellular space. Very important. Hydrostatic and your osmotic pressure. So, hydrostatic pressure, it is your pushing pressure, paglabas. Pag osmotic pressure naman, that is pulling pressure or pagpasok. And oncotic would refer to the pressure, specifically osmotic pressure, specifically exerted by proteins such as your albumin. Kaya pag nagalasan ang albumin levels natin, what happens? Nagdi-decrease ang oncotic pressure, nagkakaroon ng fluid leaking or osmosis. Take note of the word osmosis. We mentioned the word osmosis would now refer to the movement of water from low concentration of solute or your low osmolarity to high concentration of solutes or high osmolarity. So in this case, what do you mean by that? Ano bang ibig sabihin yan? Let's try to illustrate. So, movement of water from low concentration to high concentration of solute. So, in this case, so this is the fluid, this is the cell. Kunyari, may mga around, para maging specific, 3 lang ang solute content ng cell na yan. What happens kung mas madaming solute particle ang nasa labas or yung solution kung saan nakalagay yung cell? What happens is that we mentioned that by virtue of osmosis, naturally, water will now move from low concentration to high concentration of solutes. Since ito yung low concentration, ito yung high concentration, movement will be from the cell to outside, from intracellular to extracellular. So, anong mangyayari? Liliit si cell kasi nabawasan siya ng fluid kasi konti ang solute concentration niya. Your low solute concentration may also be referred to as low osmolarity or low osmolality. High solute concentration in a solution may also be referred to as high osmolarity or high osmolality. What is the difference? Osmolarity would refer to the amount of particles or solutes for every liter of solution. So, in a solution, ilan ang merong solute particles dyan? Osmolality naman would refer also to the amount of solution for every kilogram of solution. So, in this case, kilogram ang osmolality, liter ang nagamit sa osmolarity. Pero pareho silang minemeasure yung amount of solutes in a given solution. So, take note of that. In order for you to also easily understand kung ano ba yung concept ng ating osmosis, is that, or yung movement ng ating fluids, is that, we have here the saying, where salt is, water is. What do you mean by that? Kung saan si salt, nandun din si water. So, the more solute particles or salt is, mas doon pumupunta ang tubig. Kung mas konti dito, of course, pag ganyan yung movement. Kung dito yung mas konti, dito yung mas madami, pag ganun yung movement ng fluid natin. So that is again a natural phenomenon known as your osmosis. Okay, I hope you're able to grasp that, Inya. So now we will move on with the next topic. Okay, saan na yung next topic natin? Let's go back to your original handout. Okay, so we have here already your IV solutions. In the case of your IV solutions, there are two types, or intravenous solutions. We have two types. We have what you call your crystalloid, and we also have here your, saan na yun? Colloids. Where is that? Colloid solutions. Your crystalloid solutions would refer to IV solutions that would now contain small particles that will now easily pass through a semi-permeable membrane. So pwedeng mag-move yung particles from here to there because it contains smaller molecules. Colloids, on the other hand, would contain larger particles. That is why they cannot pass through the semi-permeable membrane. So what happens? They stay within the intravascular space or within the blood vessels. Your crystalloids are composed of three types or subtypes: isotonic, hypotonic, and your hypertonic. We will now try to differentiate them. So your isotonic, hypotonic, and your hypertonic solutions would now depend or are now based on the amount of solutions, the amount of solutes it would have in its solution. So let's try to look into these ones. Let's try to differentiate them. So in this case, we have here your isotonic solution, your hypotonic solution, and we have here your hypertonic solution. So in order for us to be able to easily understand them, we will be comparing yung solute concentration ng cell in the body and solute concentration within the cell ng body and solute concentration naman ng mismong IVF solution natin. So in this case, the solute concentration in the case of your isotonic solution is equal. Pareho siya dun sa amount of solutes in the cells of the body. That is why what happens, there will be no shifting of fluids. Hindi magkakaroon ng intracellular to extracellular movement of fluids. Why? Because same yung solute concentration or yung osmolarity or tonicity ng ating IVF and within the cell. Ma'am, anyang igurti importance dito yung IVF. The importance of the IVF solution of your isotonic type of IVF solution is that it would expand volume. Take note, we are still giving fluids to the patient. So nga, what happens is that nag-i-increase lang yung amount of fluid in the body pero walang shifting of fluid from any space. Expansion lang siya. So pag regular dehydration yan, we give isotonic solution. If may cellular dehydration, dun na mag-iiba. Hypotonic solution naman ang binibigay natin. So in the case of your hypotonic solution, the IVF would contain lesser solutes as compared to the amount of solute concentration or solute within the cell of the body. So in this case, anong nangyayari sa hypotonic solution? Let's have here an illustration. This is the cell. It would contain 1, 2, 3, yan, kunyari 3 solute particles. So that para ma-illustrate lang natin practically. Tapos yung concentration ng hypotonic solution isa lang. For example, ang solute concentration yan. What happens by virtue of, magkakaroon ba ng fluid shifting? Yes. By virtue of osmosis, yung movement ng fluid from low concentration to high concentration of solutes. So in this case, papasok yung tubig sa intravascular or dun sa blood vessel natin, papasok dun sa mga cells dun sa blood vessels such as your red blood cells. So what happens? It is given on cases of your cellular dehydration. It's because maliliit, lumiit, nag-dehydrate yung cell na yan. Gaputa, hypotonic solution, it will now allow more fluid to enter into the cell tapno maging normal ti itsuran ti red blood cells tayo. However, if you're just giving your hypotonic solutions, it can lead to swelling of the cell. Lalaki yung cell eventually. Mapapagod yan, no? Lahat naman tayo may threshold. What happens? Magbo-burst yan. It will now undergo what you call cell lysis or cell destruction. Pagputok ng cell na yan and eventually cell death. Pag masyadong marami yung pumupunta dun sa cell natin. So take note, hypotonic solutions are usually only best for your cellular dehydration. Hypertonic solutions naman, solute concentration is greater in the IVF as compared to the cell in the body. So in this case, so what happens naman in the case of your, ayan. What happens naman in the case of your hypertonic solution? The solution would have greater solute concentration as compared to your cell. So what happens? Again, osmosis from low concentration to high concentration of solutes. Yung tubig mag-shift from intracellular to intravascular or extracellular. So what happens? Your cells will start dehydrating, known as your crenation, pagliit. Cell crenation will also eventually lead to cell death because nag-dehydrate masyado yung cell ng pasyente natin. Very important that you have to take note of these ones. So, in the case of your isotonic, pag fluid expansion lang without any fluid shifting or any abnormalities in the cells, ayan, isotonic yan. Hypotonic, cellular dehydration most of the time. Hypertonic solution, we have here in the case of, ano ba yung mga nakalagay dyan? Let's see the examples. Oops, sorry. Wait lang ah. Okay. So in the case of your isotonic solutions, examples, we have your plain NNS, your PLRS or your plain lactated ringer solution. This is again usually used in the case of your burns. Very important because we'll be discussing this in the formulation of your or in the computation of your Parkland formula. D5 water. Please take note that in the case of your D5 water, initially that is isotonic solution. But because once nakapasok yan sa blood vessel ng ating katawan, ng pasyente natin, what happens? Your liver will now start metabolizing your dextrose. Kaya mawawala yung dextrose dyan, magiging tubig na lang. Take note, water in this case is hypotonic. So magiging hypotonic siya. Never give this to patients with increased ICP or head injuries. Again, why? Because of yung effect niya. Kasi hypotonic solution siya eventually. So initially, pag hindi pa siya nakapasok sa katawan, isotonic siya. Pag na-metabolize na ng liver yan, it becomes hypotonic. For the nursing considerations, just read on them and yung specific indications nila. Hypotonic solutions naman, less than yung normal na levels or solute concentration ng katawan. And we also have hypertonic solutions, more than naman. So we have here another illustration of what would the IVF solutions usually look like. So yung plain NSS natin, usually yung kulay ng kanyang tag is green. So that you will know that it is also your plain NSS, plain LRS naman, or yung plain lactated ringer solution natin, usually used for burns again. It is blue. D5 LRS, it is pink. D5 water, it is red. D10 water, it is blue-green. D5.3 sodium chloride, it is sky blue. So what is also the importance of knowing kung bakit isotonic, hypertonic, hypotonic ang mga solutions? It is very important for us to know all of these ones so that we will be able to know kung ano yung magiging effect niya sa katawan ng pasyente. Tapno, ibig sabihin, you should not be under-infusing or over-infusing your IVF solutions. Tapnohaan nga, bilangan nyo lang naman ng drops to 15 seconds, tas ita times for you. Again, that is not encouraged in an ideal setup of your nursing. It's because very important that we have to specifically know kung ilan ba talaga ang nai-infuse at yung nailalabas ng pasyente natin. Karkaroon nung maamuan yung hypertonic niya, tas biglang nga mali-mali gayam. Biglang nag-over-infuse kayo, biglang nag-dehydrate, or biglang nagkaroon ng emergency condition yung pasyente dahil sa IVF na binigay natin. Swerte yun, no, case na lang ngay plain NSS. Paano pag may potassium chloride pang naka-infuse dun sa medication nyo? Tapos biglang nga na-atake ti pasyente. So these are very important matters you have to know when you're going to administer or when we're going to give our patients their IVF solutions or your IV fluids. I remember one time when I was actually in college, very important, inbag na lang talaga nga nalagip mi di, in-check mi di ay. What happened in BMC is that when I was a student, third year ata kami or fourth year nung time na yon, kasama ko yung staff nurse, mayroon akong to follow na fluid para sa pasyente ko. Yung BMC is the small hospital beside Baguio General Hospital. Dag-duty kami ijay gamin, may to follow akong IV fluid na plain NSS. So tingkas tami, 30 minutes before I was supposed to change the IV fluid of the patient, sinamahan ako ng staff nurse na kumuha ng IVF fluid, tas kinita mi, binasa mi nga plain NSSDI, 0.9 sodium chloride, na normal saline solution, tapos green yung kulay nun. So, in-set up ko ija ayan nurse station. Sinamahan pa ako ng staff nurse nito. Tapos, yung ginawa ko, gumawa na ako nung card, yung IVF label niya, tas inkabil ko jay name to patient, inkabil ko jay naganti medication, tas numanong drops per minute, inkabil ko ni jay. And then, I place it here already. Nakita yan lahat ng staff nurse. Pero since maaga naming prepare yan, hinintay namin. So, nung time na magpapalit na ako, after 30 minutes, the staff nurse accompanied me, and buti na lang, chinek namin bago kami pumasok sa room ng pasyente. Pagkita ko ayan ti bottle gamin, jay bottle ti pasyente, apay nga, haanan nga green, binasa mi. Yung malagip mi nga tiin kabil mi talaga nga tagtay kat plain NSSDI. Kat sabali nga agas nalipatak no sabali nga bottle actually tinaikabil ijay nalipatak no LRS yun or D5 LRS. Nagulat kami nung staff nurse kasi amuming nga tiin check mi ijay green tea color na tas plain NSS. Tinanong namin yung ibang staff nurse, tas tinanong namin yung mga kaklase namin baka may pinagpalit sila. Tapos awan mat kano. Bag na lang talaga ta in check me kasi nung time na yon medyo nakakatakot, 3:11 shift yun eh. Awanhan mi amo no sino tinangi sukat ijay tag IV tag ti pasyente kan ijay bottle nga in prepare me beforehand. So buti na lang chinek namin. So it is very important that you should be checking your IV fluids that you are administering to your patients. Okay. Meron pa ba akong nakalimutang concepts? Let's see. Ayan. Again, just read on these ones. For your colloid solutions, usually, ito yung mga times na nagbibigay tayo ng fresh frozen plasma in the case of your blood loss. Kung wala tayong